So this is one of the most common questions we get about veneers. Won't the teeth just rot underneath? And the short answer is no. And the long answer is when we do porcelain veneers, they're first tried onto the teeth to make sure they fit perfectly. That's the first measure we take to make sure there's not going to be issues long term. And what this means is that we make sure the veneers fit onto the tooth so there are no gaps between the tooth and the veneer. And this is going to help to make sure that no bacteria can get under the veneer to cause a cavity or to cause the tooth to rot. The second thing we do to make sure that the teeth won't decay underneath is after they're tried on, we go through multiple steps to bond, glue, and seal the veneer to the tooth. And what this does is this closes and locks the veneer onto the tooth again, so no bacteria can get underneath the veneer to cause a cavity or for the tooth to rot. And that last video that we posted, or this video that I'm commenting on, is where we go through and show the steps of how we glue on the veneer and how the veneers stay on the teeth. So again, after they're tried on, we glue and bond and seal the veneer to the tooth. And what that does is it locks the veneer onto the tooth so nothing can get underneath the veneer. So it actually, the veneer becomes part of the tooth, like it's like a new tooth replacement or a new layer of the tooth that's bonded and sealed, and that bond and seal is supposed to last for 10 to 15 years, if not longer. And so the third thing we do is after the veneers are done, we take x-rays to make sure there are no gaps between the tooth and the veneer. So what we can't see with our normal eye, we take x-rays, again, just to make sure we don't see any discrepancies or bubbles or voids or empty spaces where there's a detection of the gap between the veneer and the tooth. So now, if one of these three things are not done correctly, then yes, there is a higher chance of a tooth getting a cavity under a veneer. So if the veneer doesn't fit right, if they're not bonded or sealed on correctly, or if there's gaps in the x-rays, then again, yes, the teeth underneath the veneer can possibly get bacteria underneath the veneer and result in a cavity under the veneer. Again, if you go to a good cosmetic dentist, someone who is experienced in veneers, and they're able to follow those measures, then the likelihood of you getting a cavity under a veneer is extremely low. I will say that in order to keep and preserve the health of the veneer, it's really important, just like to preserve the health and beauty of your natural teeth, that you do have to brush at least twice a day, just like you would with your normal teeth. Ideally floss once a day, just like with your normal teeth if you didn't have veneers, and go in for cleanings at least twice a year, just like you would with your normal teeth, to help maintain the health and integrity of the veneers.